Welcome to this Surge Week 2 National Lead meeting. Thank you all for your hard work, collaboration and giving up the time to be here today. We're holding these meetings every 2 weeks in the run-up to the study. For one, to bring everyone together and just to provide an update as to where we are and to the key next steps so you can disseminate them within your countries and regions, but also as an opportunity to bring people together. I hope today that this presentation will take less than 10 minutes, but actually the majority of the time is then for questions and discussion. It's a rare opportunity that we have a forum of over 130 countries bringing all brought together in one place. So it's really valuable, and thank you all for your hard work and your time dedicated towards Surge Week 2. So an outline of what we'll discuss the progress to date, the co-lead registration, which is the key bit of the study really for the next week or two, and then the next steps, which to outline from the start are to complete the co-lead registration. That's done by the hospital leads. Register people for mini teams. That is done by the expression of interest link, which I've circulated previously and will do again in my email following this meeting. And ensure that each hospital has the appropriate regulatory or local approvals in place. Without these, we'll not be able to provide mini-team logins. So it's really important that people are seeking the appropriate approvals. And then, like I said, the majority of this hour session will be left for questions and discussion. So to date, we have over 9,000 expressions of interest from throughout the world, and this was taken from the website map updated on Monday. And as you can see, we've together have covered most of the world, and that's thanks to all of you sharing this within your countries, within your networks. It's a truly global study, so thank you all for your input and your collaboration. Without you, this wouldn't be possible. The key bits of where we're up to. So the DSA template is live, as we've discussed previously. Unfortunately, it's non-negotiable in terms of the template, and that's because the volume of DSAs required for the study will overwhelm the University of Birmingham's legal system. Therefore, they've created a template that you cannot negotiate but sign, and then if you send it back to us, send it back to my email, which is the email on the slide there, and we'll send it to our legal team. If you do have any issues or questions, feel free to email me or through the joint email box, which is on the last slide, and we can address those as we go. As I said, we've got over 9,000 clinicians that have expressed an interest from over 2,000 hospitals in 131 countries around the world. Truly phenomenal. Thank you all for your hard work. And the hospital lead selection, which we discussed in the last meeting, is effectively complete. There's only a couple of countries left who have some legal frameworks that they're working through, but that stage is complete. So thank you very much. As you know, the structure of the study, in each country there's one or multiple national leads who have selected their hospital leads, which again I've just said has just been complete. The hospital leads then must select their co-leads, which are currently happening now, and we'll go through the number of co-leads in a second. And then together in the next phase of the study, the co-leads and hospital leads will be able to select who they want to be in each of their mini teams. The hospital leads' other roles are to ensure that they have the local regulatory approvals in place. These will need to be evidenced on REDCap, and we will not be able to provide mini-team logins until appropriate approvals are in place. And at the end of the study, they'll have to complete a hospital site survey. In each hospital, there is only one hospital lead, as we need one person to take responsibility, mainly for the local regulatory approvals and completing the site survey. But for co-leads, there can be multiple. The co-leads can be of any grade, any speciality, and you can have no co-leads or you can have as many co-leads as you wish. We'll leave it down to the hospital lead to decide. What we would suggest as a pragmatic or simple way of sorting it is to do one co-lead per speciality. And the role of the co-lead is to encourage people to sign up through the expression of interest link and sort the mini teams with the hospital lead's input. The mini teams consist of 3 people. If the co-lead and hospital lead wish to collect data as part of the mini teams, they need to ensure that they select themselves for this in the mini team selection so that we give you the right access on REDCap. Mini teams will collect all data on consecutive eligible patients for the specialities that they plan to collect data for, and that will again be outlined through the REDCap form when it goes live. Mini teams can choose to collect data for one or multiple specialities for one or multiple time periods. Clearly, in larger hospitals, that means there'll be multiple mini teams working, collecting data on consecutive patients in different time periods or different specialities. So if you're the hospital lead and you were to log in to do your co-lead selection, you would see something similar to this. So this is one of the, hospitals in Nigeria that have got a fantastic amount of people sign up. And you can see through the expression of interest form, you select which speciality you are part of. And this form will then divide you into these specialities so that if you click on the blue link, it will take you through to all of the general surgery people that have expressed an interest in being a co-lead, and the next one for anaesthesia, and so on and so on. You select whichever number of co-leads you wish for each speciality and then click save, and that is the process complete. My colleague Cortland's made some fantastic documents on how to do this in a YouTube walkthrough, so please look at these if you need to, and I'll send them round in the email. So the next steps really are to ensure that hospital leads complete the co-lead registration, get everyone to sign up through the expression of interest link, which I've circulated previously but will do so again in my email, and ensure that hospital leads have the appropriate local regulatory or ethical approvals in place in order to do the study. All the links are here, so the protocol and study documents, as you know, are all on the website. We've started a number of social media pages which will provide regular updates, and for any questions please contact me. You all have my email address, or contact the joint mailbox which is there at the bottom of the page. So I'll leave the rest of the session really for discussion and questions. I'll open the floor for that, but before I finish talking, I just once again like to say a massive thank you for all your hard work, your collaboration with this. It's fantastic to see the momentum of this study building. Really excited to launch it in just over 4 weeks' time. Any issues, please get in touch, but I'll now open the floor to questions.